Welcome everyone to today's video, where we'll be showcasing the transformation journeys of multiple patients. So, let's begin with the journeys of our first patient and see how their hair transplant surgery transformed their appearance and boosted their confidence.
Today, we bring you the journey of a patient who traveled from the United States to India, choosing QHT Clinic for his hair transplant. In this video, he shares his transformation story, from the initial struggles with hair loss to the life-changing experience at our clinic. He'll also reveal what motivated him to trust QHT Clinic for this important decision. So, stay tuned till the end to witness his inspiring journey. If you are also experiencing hair loss or baldness, send us your pictures for a free consultation. Our experts are here to guide you. Now let's take a closer look at his pre-surgery condition. The patient was experiencing diffuse grade 3 baldness, a stage where the frontal hairline had receded in a classic M-shaped pattern. This led to significant thinning on the temporal areas and a visible reduction in density across the frontal zone. Fortunately, the mid-scalp and crown regions still maintained healthy hair growth and didn't require any surgical intervention. Another advantage in his case was the donor area. It was in excellent condition, with dense and healthy follicular units. This gave us a strong foundation to design a natural-looking hairline and restore volume in the affected regions effectively. Now, let's hear from him about how baldness affected his life.
Hi, my name is Akshit and I'm 29 years old. I'm from Seattle, Washington, US, and today I'm here for my hair transplant appointment at QHT Clinic. I've been facing this issue for the past 2 to 3 years where my hairline has been receding for quite a while. I started noticing this pattern while I was attending my brother's and friend's wedding, where when I looked back at the pictures, it hit me that my hairline has receded quite a while. And the reason of my hairline receding, I would say, has been due to family genetics. It's a genetic problem, and then also, of course, since I live in the US alone away from my family, the stress has been enormous, and I feel like that also contributes to the stress also contributes to the hair disappearance eventually. In these past 2 years, when I saw this baldness or the hairline receding pattern, I decided to do something about it. And I started doing my research on different clinics in the US, in India, even in Turkey, what would be the best option to go to. And since I grew up in India, I have a lot of friends here who've been going through the same issues. And when I was visiting my parents, I came across my friends who have got their hair transplant done in the past year in 2024 from QHT Clinic. And when I saw the results, I was quite impressed. So I started reaching out to them to see if they would recommend me going to the QHT Clinic. And right now I'm here in India for vacation for like a couple months. So I decided to visit their clinic and I decided to give it a shot. And from the looks of it, from the results of my friends, I would say I would highly recommend it. I cannot say that for myself as of now, since I still have to go through my procedure. Of course, subconsciously, it's always going to happen when you have a receding hairline, the confidence issues comes up. But I've always been a pretty confident person. But when looking back at the pictures, when you compare yourself from like 4 or 5 years ago, when you have a head full of hair, and to now, it always goes into the back of your mind what could have been. It hasn't affected my personal or professional life in a big degree, but at the same time, in the back of my mind, it always bothered me a bit. So I've always wanted to get this over with, get the hair transplant done so that I can get that 10% confidence that I lost back, to be honest. So yeah, just to kind of like overcome this issue, in the past or currently, I've been wearing a lot of hats to, let's say, to the gym, or when I go out for dinner with my friends, or just grow out my hair like longer so that I can just push my hair a little forward so that I can hide these bald spots a bit. But I'm glad finally, after getting this hair transplant, I won't need that anymore. For me to go for the hair transplant, the number one reason being I've seen my friends do it and they have huge, not like me, I still have hair, they have a lot of baldness, and when I saw them doing it and I saw the results, it just pushed me to get my hair transplant done as well. I don't have I don't have a lot of hair loss, but at the same time, just to get that hair back of what I looked like 3-4 years ago with full hairline, that excited me. So And just to look good, get that confidence back, I decided to go for the hair transplant. The reason I decided to get the hair transplant done right now, when I'm 29, is because I'm not getting any younger. And the other thing is, in the near future, since I'm a bodybuilder, I'm going to step on stage, and I'm going to be traveling a lot soon. So I thought, just get it over with, because who doesn't want to look good in their pictures, and especially on stage since I'm a bodybuilder. So I just wanted to get this hair transplant done so that I can step on stage finally in the next year or so. And I would say during the consultation was the main part of pushing and choosing me towards QHT Hair Transplant Clinic, along with my friend's suggestion. During the consultation, the consultant answered basically each and every one of my questions relating to my lifestyle, what can be expected. I asked them questions about what does the hair transplant look like, what do they generally do, are the doctors going to be involved, how qualified are they. He was also willing me to show me their degrees. He also said how many people were going to be there, the anesthesia procedure, how does that look like. He basically gave me a breakdown of what the procedure looked like from a day-to-day on an hourly-to-hourly basis. He also showed me the technique they would use. He also showed me the results. He also showed me how they would consult through various different WhatsApp group on how the procedure is monitored through each and every step. So I would say the art of listening from that consultant was very good, because he basically answered each and every one of my questions, also related to my medical history, my lifestyle. And I would say that was one of the main reasons of me choosing the QHT hair transplant.
After the consultation, the patient was taken for a head wash and hair trimming session, both essential pre-procedure steps. These help prepare the scalp for accurate planning and execution. Our expert team then carefully designed a personalized hairline. This ensures the hairline not only looks natural, but also complements his overall facial aesthetics. Once the hairline was finalized, the affected frontal zone was precisely outlined. These outlines act as a surgical roadmap, guiding the implantation process with precision and artistry. If you also want your perfect hairline back, then comment hairline. Once the hairline design was finalized, the patient was taken into the operation theater where the procedure began. Let's now hear directly from the patient about their live OT experience.
When I first came in, of course, I was a little nervous, right? But as the surgery progressed, everyone, the technicians, the doctors here, made me feel like home. I had no issues at all. I was even offered food. From time to time, they even asked me if I was feeling okay, if there's any pain or not. And even if you're feeling any pain, just let the doctors know. They have like the anesthesia on point. They'll just administer to your scalp, and you'll feel no pain at all. So in all, I would say it was a really good experience, painless. I would say out of 10, the pain levels were like maybe 2, only when they're administering the anesthesia. Other than that, they're very helpful. You even get to have food in between if the sessions are longer. You even have get to go to the bathroom if that's what you want to do. But I would say, in all, out of 10, the experience was 10 on 10. I loved it here, no pain at all. I'm just looking forward to the results now. Of course, when I go back, I'm excited to show the results to my parents and my friends, because some of them have been on the edge of getting transplant themselves, and me getting here first and me setting an example for them, it's gonna push them towards getting the hair transplant themselves. And of course, there are a few important events for me coming up, like my brother's wedding, my best friend's wedding. So I'm just looking forward to the results and see how the hair transplant results look in the near future. Thanks to the QHT team clinic, all of them here. From my first day arriving here, from the consultation with the doctor, they cleared each and every one of my queries, to the slip making, which was again seamless, to the operation itself today, which was extraction and implantation. It was all seamless. They cleared all my questions, and I'm now just looking forward to the results. So thank you to everyone involved in the QHT clinic. They have been doing a superb job. Thank you so much.
Now, let's learn in detail about his surgery, where the procedure began with the administration of local anesthesia in both the donor and recipient areas to ensure a completely painless experience. After the anesthesia was administered, our experts proceeded to create slits in the recipient area. This is a crucial step where the density, angle, and direction of implantation are precisely determined to ensure natural-looking results. Then, the extraction and implantation process began, performed using our advanced QHT FUE technique. This method involves simultaneous extraction and implantation, which minimizes graft out-of-body time and enhances graft survival rates. During implantation, single and thin hair follicles were implanted along the hairline to achieve a soft, natural, and feathered appearance. To enhance volume and density in the frontal region, double and triple follicular units were strategically implanted. In this case, a total of 2,700 grafts were used, all harvested from the patient's safe and healthy donor zone, ensuring long-lasting and natural results. Now, let's hear about his experience after the procedure and how he felt post-surgery.
Hi, my name is Akshit, and as you can see, my surgery's been done. Today was my surgery day, which included basically extraction and implantation. I arrived at the clinic early in the morning since it was going to be a long process. I went straight into the OT. The doctors and the technicians were very helpful. It started with basically with numbing, giving me anesthesia and some medications. The anesthesia and the medication helps calming you down, and the anesthesia also like make sure you don't get any pain during the process. All the process, it took me around like 6 to 7 hours. It was seamless, from getting the meals on time, getting help from the technicians or the doctors. If I wanted to go out for a bathroom break or needed water, they were very accommodating. The experience in itself, like I said, was very seamless. I didn't have any pain besides when they were administering the anesthesia itself. But besides that, it never really felt like I was going through a procedure. The procedure lasted about 6 to 7 hours, which included some breaks as well. And if I were to scale the pain out of 10, I would say maybe 2, not even 2 sometimes. I never really felt the process. It was an 8-hour process today. And I would say out of those 8 hours, I only felt pain for like maybe 5 minutes. And even if you felt pain, you could just tell the doctor or the technician that you're feeling the pain, and they would administer the anesthesia again, and then it would go away again pretty quickly. So I would say the big mythbuster was the pain in itself. It's not that painful at all. The technique that I used at the QHT clinic was FUE QHT. Basically, it's a 2-day process where first they make your file, check your blood levels, check your blood basically to make sure you're okay and ready to go through the process. And then that day also includes your hairline designing, which is a long process again, along with the consultation with the doctor. And then once you're finally happy with your hairline, and you like what you see, you go through the procedure of slit making on day 1, which involves making slits in your implanted area where you want to get your hair transplant done by the technicians. And it also involves the the process of giving you the anesthesia so you don't experience any pain. I would say this process of dividing this whole procedure, hair transplant procedure, into 2 days was the best case scenario. That's what QHT does. That gives you the time to rest and recover, and then the next day, which is today for me, I came in for my final hair transplant, which was extraction and implantation, and which is a long process in itself. In this procedure, they basically just simultaneously extract your grafts from your donor area and simultaneously plant the grafts in your implanted area, which basically gives less of a chance of the grafts to basically go bad or die over. So I would say this process of QHT, of dividing this whole procedure into 2 days and simultaneously doing the extraction and implantation, is a really good process. It gives time to the patient to recover as well. And since it's a long procedure, it gives the time to the patient to kind of like mentally recover as well from the procedure. By currently looking at my hairline and the transplanted grafts, I can see I'm very hopeful of the result that I'm looking at. Again, we'll see how it looks like in a year from now. That's when you fully recover from the hair transplant. But from the looks of it, the hairlines looks good. The way it was designed, it looks perfect, and I'm just excited to see the result. And I think from the looks of it, I'll have a pretty good hairline with the good density of hair as well, as you can see. So I'm just excited and looking forward to the results. Okay, so now that's it from my side. I'm gonna go get my dressing done. And I'm just looking forward to the results. Since it's a time-taking process, I'm just looking forward to see what it looks like in 6 months from now, maybe 3 months from now, and I'll keep you guys posted. So if you want to tag along the journey, keep posted. I'll share the results with you pretty soon. Thank you.
As this was his surgery experience, we will also share his monthly progress results with you.
Now, let's move on to the next patient.
Today in this video, facing the challenges of Norwood grade 2 baldness. His hairline completely receded and changed into an M shape, which affected his frontal areas. Along with the hairline, his temple also vanished, while the rest of the scalp is healthy. Thankfully, he had a dense donor area, which plays here significant role in his transformation. After examining the complete scalp, the patient's hair was trimmed and the scalp was washed. Then our experts, using their science and art skills, designed a custom-shaped hairline and temples that perfectly frame the patient's face. Designing hairline is the most important part of the transplantation process, as it provides natural results and can also lead to unnatural results. Our experts have become skilled in this art, designing more than 5 hairlines daily and having designed over 10,000 plus hairlines to become experts in their work. The hairline was carefully positioned slightly lower in the middle, measuring exactly 7 centimeters from the glabella point, and they also marked the affected areas. During the procedure, single thin hair follicles were implanted in a zigzag pattern in the hairline, while also implanting the same follicles in the temples to achieve complete and natural results. To provide volume and density in the frontal area, double and triple hair follicles were implanted. In this process, a total of 4,000 grafts were implanted from the patient's safe donor area. Additionally, our doctors advised the patient to wear a surgical cap to protect the scalp from dust and sunlight, and to apply saline spray twice a day regularly to keep the transplanted areas moisturized and clean. 2 months after the transplant, when the patient visited the clinic for his first follow-up PRP session, our experts noticed the transplanted hairs were shed, and at the same time his donor area completely healed. This time, our doctors recommended minoxidil and finasteride medications to the patient. Minoxidil. This comes in topical solution or foam form that is applied directly to the scalp. It improves blood circulation and helps stimulate hair follicles to promote new hair growth. Additionally, the PRP sessions are also recommended to be taken from time to time. Four months post-transplant, when the patient came to the clinic for his next PRP session, the shedding phase had ended and new hair had started to grow on the scalp. At this stage, hair follicles actively begin to grow new hair, but the initial growth is a bit slow and the hair may appear thin and delicate. So there is no need to panic in this condition. Patience is required. During this period, the roots are settling and will provide voluminous results in the upcoming months. 11 months after the transplant, the results in the transplanted areas are visible and truly outstanding. The patient's hairline and temples were now fully well defined, perfectly framing his facial features. These results have significantly enhanced his overall appearance, making him look younger and more energetic. The frontal area has achieved voluminous density, giving him natural and a fuller look. Now, no one can differentiate between the transplanted hairs and his native hairs. This transformation has not only restored his hair but also boosted his confidence. Such remarkable results have been possible by continuing the PRP sessions as well as properly following the precautions and medication advised by our doctors. If you have been facing the challenges of Norwood grade 2 baldness like our patient and believed the myth that only a completely bald person can undergo a hair transplant, I hope this video has cleared your doubts.
Hello friends, if you have not subscribed to our channel yet, please like this video, share and subscribe to our channel, and don't forget to hit the bell icon so that you will get update on every video.